Welcome, everybody. We are so excited for this week. We are going to do Hypnosis Week with our good friend, Dr. Jeff Zeig. And
so happy to have you.
Jeff and I have known each other for a long time. I've been a huge fan of him. He's a psychologist. He's the founder and director of the Milton H. Erickson Foundation, having studied intermittently with arguably one of the world's most famous hypnotists. He studied with Dr. Erickson for 6 years. He's edited, co-edited, authored, or co-authored more than 20 books. I've reviewed a number of them. They're in 12 languages. Wow. His current area of interest is in extracting implicit codes of influence for various arts, including movies, music, painting, poetry, and fiction, that can be used to empower professional practice in everyday communication. Dr. Zeig is the architect of what I think is the world's best psychotherapy conference, the evolution of psychotherapy, where I am blessed to be able to teach, considered one of the most important conferences in the history of psychotherapy. He's just awesome.
Well, and before we get started, Jeff, you've also been heavily involved with something that's been very important to both of us, right? So Man's Search for Meaning, yes. Which is just one of the best books I've ever read. And you've had a big part in, which foundation is that?
Well, no, I was the person who had the Viktor Frankl archives for many years. And I was distributing the lectures of Viktor Frankl until relatively recently. So Viktor Frankl was somebody who I met, and we did a podcast where I talked some about my experiences with Viktor Frankl. He was one of those people who vindicated the earth by virtue of his presence on it, someone who was a wounded healer who had transcended so many difficulties. And Milton Erickson, who Dan just mentioned that I studied with, was similar. Somebody who was living the talk. And they weren't just saying, well, yes, you could use hypnosis to control pain. He was doing it right before your eyes. Milton Erickson was. Viktor Frankl had a different focus, a different fulcrum that allowed him to reshape his life after being a Holocaust survivor in 4 different concentration camps. But yes, Man's Search for Meaning is one of the most important books I've ever read. It's 10 million copies that have been sold in multiple languages.
Yeah, if you haven't read it, you got to read it.
Right. Yeah, absolutely.
So Dr. Zeig, being one of my mentors, actually studied with 2 of the most influential people in my practice,
right?
With Viktor Frankl and Milton Erickson. But I think a lot of our listeners may not know about Milton Erickson. So why don't we start with your interest in hypnosis? How did that come about? And a little bit about your work with Dr. Erickson.
Sure. I was in my master's degree program in 1972 in California. And I had a supervisor. And my supervisor was not the person who I wanted to supervise directly, because I had a psychologist who I thought was an excellent supervisor. So I asked my psychiatrist supervisor, would he please teach me hypnosis? And he said, sure, come to my office on Saturday, I'll hypnotize you. Oh, wait a second. I thought he was just going to use the time to give me some academic education. So I went to his office on Saturday morning, and I was nervous. I was scared. I didn't know anything about hypnosis. And I was anxiously drumming my fingers on the arm of the chair. And being an astute professional, he said, okay, watch the pattern of your fingers and notice how the movement changes. And that was my first example of utilization, which was the foundation of everything that Milton Erickson did as an expert in psychiatry. So I said, please tell me, what can I read? He said, read Milton Erickson. I said, who? He said, Milton Erickson. There was only one book, which was a compendium of his papers. And I picked up that book and I thought, oh my gosh, this is incredible. This is light years beyond anything that I had conceived as effective psychotherapy and effective hypnotherapy. So I dashed off a note to my cousin who was studying nursing in Tucson and said, well, if you ever get to Phoenix, visit Milton Erickson. He's a genius. And she wrote me back and said, don't you remember my old roommate in college? Roxana Erickson, and I then found Erickson. I wrote to him. I sent him a copy of a paper, the first paper that I wrote, professional paper on hypnosis. I said, could I please be your student? And he said no. He said he was too old, he was too ill, he wasn't taking students. But he personalized the letter. He said, when you read my writing, don't pay attention to the wording, the technique, to the composition of suggestions. The really important thing is motivation for change and the fact that no human being ever fully knows his own capability. Now, I must have read that 15 times sitting in my little green Volkswagen, having just taken that from the mailbox. I was amazed that this genius was personalizing a letter to an admiring student. So in 1973, I made my first visit to Milton Erickson. Now, Erickson, in the history of psychiatry, would be considered one of the most effective therapists in the history of psychotherapy. And he added more cases to the literature, more successful cases than anyone has ever added. And many of them were based in hypnosis, but many of them were derived from hypnosis. And it was a peculiar form of therapy because, as most people conceive therapy, it's an examination of their history, or it's an education in how to change their negative thoughts into positive thoughts. But to Erickson, therapy was a conceptual journey where the recipient of the communication needed to realize a concept, and by virtue of realizing that concept would be able to change their identity. I can go on. When I visited Erickson in 1973, he was confined to a wheelchair. And he had spent the last 13 years of his life in a wheelchair. And he was practically quadriplegic. That's not medically correct. He had polio when he was 17, and he had post-polio syndrome, couldn't use his legs, was ataxic. He was moving back and forth, couldn't control his movements very well. In order to eat, he'd have to guide his right hand with a spoon up to his mouth, because his left arm was much more mobile than the right side of his body. And this man just perfumed the atmosphere with being glad to be alive. And I was so mesmerized by him, so touched by him, that he was spending his precious time helping me to be not just a better therapist, but a better Zeig. So I've dedicated a lot of my career to taking the concepts that Erickson has developed, the methodology that Erickson has developed, and I travel around the world and I teach about Erickson, the spirit of Erickson. And there's been lots of people, lots of genius who visited Erickson, including Margaret Mead and her husband Gregory Bateson. Erickson did a collaboration with Aldous Huxley. He was a person who was studied at the Macy conferences in New York, where cybernetics was invented. Erickson was one of the people who was studied by neurolinguistic programming. So if you saw a motivator, somebody like Tony Robbins, he would be derived from Milton Erickson. So Erickson is not just...
Yeah, no, I was going to ask you about that in a minute.
Can you talk about, so if you had to list the top 4, 5, 6 things that you learned from him that you teach over and over again, what might that be? So in the Brain Warriors Way podcast listeners, what are some of the practical things they can take away from his work?
Well, this concept of utilization, that whatever exists in the totality of the situation, rather than analyzing it, we find a way to utilize it. It's an alchemical process. This was a man who could turn straw into gold. So if a person was short, he found a way of using that. If a person was tall, he found a way of using that. One simple anecdote is working with a young child, 8 to 10 years old, and she was feeling very bad about herself. And what Erickson wanted to develop her self-esteem, so he challenged her to a bicycle race. Now, of course, the child knew that Erickson would beat her in a bicycle race, but Erickson knew that if he used his right leg to pedal, he wasn't going to get very far, and if he only used his left leg to pedal, he was going to beat the girl. So he just used his right leg and his left leg, and the girl had the opportunity to feel herself doing something superior to an adult. Now, in that case, he used his infirmity to help somebody else. And that was the understructure of both Viktor Frankl and Milton Erickson. How can you take something that other people would look as a deficit and turn it into an asset?
Jeff, can I ask you a question? From what I understand, because I actually love NLP and I've taken courses in it, and I just think it's a shortcut to change, really. One thing I had read, and maybe you can answer whether this is true, that Erickson is credited, and people like Tony Robbins and other NLP students talk about, he was masterful at changing people's states like almost instantly. My understanding is he used physiology, the environment, and language to do that. So, I mean, that to me is really exciting because it means anyone can do it if you just learn how to do this. It's a really important concept.
Right. So a simple way of thinking about that is a parent talking to an adolescent child. The parent wants the child to be responsible. Now, if the parent says to the child, be responsible because you'll have a better life, you'll have a better family, you'll meet the dictates of your dreams, that sails over the child's head because the parent is trying to get across a concept. Now, the adolescent already has the idea. So there's a series of stages. How do you move the idea into a concept? The concept is, I can be responsible. Now, in order to do that, you need to have an evocative experience. If that evocative experience is an anecdote, or that evocative experience is hypnosis, or it's even joining a sports team or getting a puppy to take care of, suddenly the idea, I'm responsible, which is in the person's left hemisphere, suddenly moves across their corpus callosum into their body, and they get the idea, I can be responsible. Now, there may need to be another evocative experience to move from the land of a concept to the land of a belief, an orientation. I will be responsible, which then can transform itself into a state, a reference experience. Oh my gosh, I'm being responsible, which then finally, in its most fulminant form, becomes an identity. I'm a responsible person. Now, in order to get across a concept, you can't use the same kind of logic that you would use to send a rocket to the moon.
Right.
That's a very complicated thing, but it is something that's an algorithm. This is why I study art. And this is what I try to teach my students about hypnosis, that hypnosis is the mother of experiential approaches to psychotherapy. You don't use hypnosis to give people information. If you want to give people information, you just give them the information. And that's great. If it suddenly cooks and they get a realization from information, super. But because in my experience of almost 50 years of being in psychiatry and psychotherapy, what I think that people need is an evocative experience that helps them to get that conceptual realization. Of course I can.
Right.
And when I visited Erickson, confined to a wheelchair, practically quadriplegic, he perfumed the air with, of course you can change your state. Of course you can change your identity. Of course you can cope adequately with limitations. Of course you can.
Right.
And he lived it.
And I
so
know
right
one
now
thing.
I'm writing Erickson's biography.
Yeah.
And I want that to inspire people like you would be inspired by reading Man's Search for Meaning.
That's awesome. I know one thing on a smaller scale, not long-term change like you're talking about, like the concept of a child learning responsibility, but people often think it's silly, or they don't understand why people like Tony Robbins will have you jump and they'll play loud music and scream and all this stuff. But he tells you why, because change happens when you're in peak state. So if someone comes in depressed or they're sitting, slouched, he wants to change their state before he teaches them a concept. So before he gets them to take in new information, because they're more likely to take it in peak state. That's kind of what I was talking about with physiology. And I really love that idea that means I could do that myself. If I change my physiology to an extreme, if I am depressed and I go out and go for a run, right? I'm going to change that physiology from a depressed person to...
Absolutely.
Right?
And you nailed it to say that there's many routes to changing states, and physiology is one path. And therapists like myself have been very prosaic. We've been very vanilla. We haven't learned how to use arousal states to help people to transform from something that is unadaptive to something that is more adaptive. And Tony Robbins, who I adore, I have gone to a couple of his seminars. he is an expert at using arousal states, but many ministers, they're also very good at using arousal states to help people realize faith.
Yes, agree.
So when we come back, we're going to talk about some of the myths and misconceptions about hypnosis, why still
people are afraid.
Hundreds of years after it started being used medically, are people still afraid of something that's incredibly powerful? Stay with us. Welcome back. We're here with Dr. Jeffrey Zeig, and we're talking about Milton Erickson and hypnosis.
So interesting.
And in this podcast, we're going to talk about some of the myths and misconceptions about it. So I learned it when I was a second-year medical student at Oral Roberts University. So for people who don't know, Oral Roberts is evangelical Christian university, and the chief of psychiatry taught it to us. In fact, put all of us in a trance, and I'm like, wow, this is so interesting. And I actually took a month elective with Don Schaefer at UC Irvine when I was a senior medical student, and I've just been in love with it. But at ORU, there were people who said, oh, you shouldn't do that. It's opening people's minds to the devil and demonic forces. And, you know, growing up, my dad's favorite word, we've talked about this, is bullshit. And my second favorite word was no. And having been hypnotizing people for 40 years, it's complete nonsense that you're opening someone's mind to the devil. I mean, I suppose if you're a Satan worshiper, that, you know, whatever you do is harmful.
There's probably some personal responsibility for the person being hypnotized to go to someone they trust.
But I was always curious about that. The Roman Catholic Church approved hypnosis as a medical treatment in 1954, the year I was born, and the American Medical Association, I think it was 1956 or 57, approved it as a standard medical treatment.
You know, one could argue that the Catholic Church actually uses some of what they do to induce some kind of trance. I mean, it's like the beads, focusing meditation on the beads is a meditation type inducing state. Some of the chanting and the beads, and I know my family was Catholic growing up. I never sort of got it, but anyways, but just last week, because I do study NLP and I really like it. It's a great way to coach people because it just induces this change quickly. We mentioned in the last episode. Last week, I read an article about it. I'm like, why do people feel like NLP and hypnosis, which are often, you know, people use them together because people who like NLP often like hypnosis, which I do too. This woman talked about NLP and hypnosis in this article being of the devil and how you are opening your mind and how truly evil it is. This is last week. Now, I'm Christian, so I'm a little confused by this. So I meditate, I pray.
So let's let Jeff answer.
Yeah.
So
Yeah,
let's.
We're all suspicious of undue influence, and we're all susceptible to undue influence. And probably the greatest purveyors of undue influence right now are either marketers or the movies, because the techniques that movie makers use, the techniques that marketers use, influence you in subterranean ways. And this is part of our evolutionary biology, that we respond to signals without cognitively processing. We don't need to cognitively process, we respond to signals. And this is part of our evolution, and we built our verbal communication on top of that. Now, we reject the idea that we are being influenced outside of our awareness. And yet, we know from thousands of studies in academic psychology, in social psychology, that we are consistently influenced by factors that are contextual, that we don't even realize. We know that if you paint a restaurant wall red in the United States, people will spend more money. We know that if the waitress in a restaurant repeats your order with a smile, you'll tip her more. We know that people are subject and biologically designed to respond to things, but somehow they're similarly designed to resist influence. If you push on somebody's head, they're going to resist, no matter, even if they're inviting you to push on their head. Mm-hmm. So we have a natural tendency to honor our autonomy. We try to think that we're the captain of our fate and the master of our soul, and that we do that out of our own design, when the automaticity of everyday life shows us through myriad studies that we are subject to influences that we can't consciously be aware of. Now, hypnosis uses that, but so do movies. Mm-hmm. Because, for example, in a regular movie, you see one cut every 7.8 seconds, but you'll leave that movie never even realizing that you saw a cut, and you won't realize that the editor of that movie is making a cut when he wants you to blink.
Exactly.
The movie maker is trying to get you to attune to the movie, because a cut is a discontinuous movement, and if you move your head discontinuously, you have to blink. Well, and a great editors will be influencing you through directors, through the music, through the design. So we tend to believe that we are autonomous creatures, but we're really not. And modern neuroscience shows us that we respond without necessarily realizing the response or the cue that led to the response.
So let's get to the myths and misconceptions about hypnosis. And one of them is, you can make me do things I don't want to do.
Exactly. So there's two myths about hypnosis.
You keep trying to do that with me, and it hasn't worked yet.
Yeah, except you're married to me, and you said the only way you're running is if you're chasing me.
Yeah, you did get me to do what you did. Oh my gosh, you are just you are an evil person.
All right,
did you see that?
Back to Jeff.
He got what he wanted.
I got what I wanted, which was you in my life
he used
forever.
A hypnotic-like technique, but not with the necessity of a formal trance.
Dear Lord.
Uh-huh.
So you said there are two things, Jeff.
Two myths: control and control.
Yeah.
So people believe that if they go into trance, they can have incredible control, or they believe that if they go into a trance, they'll lose control. They'll do something embarrassing. They'll be forced to do something against their moral spine. We know from social psychology studies that people can be induced to do things that involve moral disengagement, and you don't need to have hypnosis in order to cause people to morally disengage. The social pressures are enough to create moral disengagement, but people are certainly afraid of hypnosis because of the press that hypnosis has gotten about the loss of control or the gain of unreasonable control. maybe if I go into a trance, I'll remember everything that I've ever read in my entire life. Doctor, can you please hypnotize me so I can find the diamond ring that I've lost 10 years ago? I know it must be in my mind, and if you just hypnotize me, we'll get that information out of my mind. So people come to me with all kinds of distorted myths about what hypnosis can do. And like Tanya was saying, that hypnosis is a state of focused attention. It's a state of focused concentration. And we all have resources, mentally, physically, biology, that we don't necessarily recognize. So the paradox of hypnosis is that it's a way of waking people up, not putting people to sleep. You're waking people up to resources, potentials that they have that they hadn't realized.
What's funny to me is you touched on something really interesting about how people are afraid of losing control and going against their own moral fiber. And yet people all around us, even really good people, go out and engage in drugs and alcohol every weekend, which completely eradicates their free will and causes them to do things that they wish they hadn't done, right? And that's intentional.
But I like what you said. Hypnosis is a state of focus.
Right.
And the imaging work on hypnotic states shows that the brain actually increases in activity, that it doesn't decrease in activity, especially the front part of the brain, which is the ultimate state in being human. It's having good frontal lobe function. So you're focused and you have more forethought and control.
But you have this tool that you can purposefully use to increase, heighten your awareness, to utilize more tools. And people, as you stated just a few minutes ago, do things every day that affect how they, how suggestible they are in essence. And one, like I just said, it's chemicals, taking pills, medications, and they do that willingly. It's just hilarious to me that they can't see it, that people don't see the discrepancy there.
So let's talk about some of the uses. Over the years, what have you found hypnosis to be the most helpful for?
Well, hypnosis has been used in every facet of medicine and psychotherapy. So hypnosis has been used with severely disturbed psychiatric patients. Hypnosis has been used gynecologically. Hypnosis has been used dermatologically. It's been used obstetrically to help women deal with childbirth. The literature on hypnosis and the way in which it's been used is massive. If you think about a wart, a virus that you might have on some part of your body, and the fact that somebody could use some suggestive therapy like hypnosis, and they could use some mental event that changes a virus that's growing on their skin, if somebody could think of the mechanism that's involved in that, figure out the mechanism, you'd probably be able to win a Nobel Prize. We know that hypnosis can change gastric motility. There are some protocols that are being used right now for people who have irritable bowel syndrome. It's a very difficult thing for GI doctors to treat, but there's protocols that can be used with hypnosis where you go through a series of sessions and you can have adequate control, because we know that even gastric motility can respond to suggestion.
It's really interesting, Rabbi G with Kids Kicking Cancer. So I have a friend, Rabbi G, and he's a black belt as well, and he started a nonprofit called Kids Kicking Cancer after his little girl died from leukemia, and she was in severe pain. And so he was in the hospital and seeing these kids scream in pain and being tied down, and he just didn't like it. And he started this nonprofit that's now all over the world. And they go in, now they don't call it hypnosis, right? But he essentially uses techniques we use in karate, breathing, visualization. And he gets these kids to quiet themselves down, take deep breaths, breathe in the light, breathe out the pain. And he does this over and over, breathe in the light, breathe out the pain. And he visualizes themselves being warriors and going through this process with strength, and doesn't call it hypnosis, but essentially that's what you're doing, is getting these kids.
Suggestive therapy.
Exactly.
Yeah, and maybe better not to call it hypnosis, because when you call something hypnosis, you activate those two myths about control, and you activate more resistance.
But these kids end up not needing to be tied down. They end up feeling good about they wake up and they're like, wait, is it done?
Well, guided imagery is often a part of hypnosis. So when I think of the stages, it's often focused attention. So I'll have someone focus on a spot on the wall above their eye level, learn that from Dr. Erickson, get their eyes to naturally be tired. And when you suggest they are tired, that sort of works. It helps. So focus on a spot, progressive relaxation, something he called deepening techniques, and then guided imagery. And I know you've worked with a lot of experts. Martin Rossi's also an expert in guided imagery, if I remember right. And the imagery is so important, but some of the hallmarks of hypnosis is time becomes distorted. And I actually use that. You know, a minute here in the office will seem like an hour in the park or the mountains or wherever you use the imagery. And lessening pain is another one that I used it a lot in medical procedures. And my favorite, when I was an intern at the Walter Reed Army Medical Center, Hal Wayne was one of my teachers. And we used it. I remember my first professional paper, I had a Parkinsonian patient. His name was Fritz Perls. He was actually a World War II hero and wrote a book called The Forefront War about how he helped Jewish people escape the Nazis. But he had terrible Parkinson's. And, you know, I'm on the neurology service, and unlike my neurology colleagues as a psychiatry intern, I like talking to my patients. And so I actually have a very good relationship with Mr. Perls. And all of my patients, when I was an intern, wanted me to give them sleeping pills. And I'm like, yeah, the hospital's a hard place to sleep, but would you mind if I hypnotize you first? And he thought that was just a wonderful idea. And he has this terrible tremor. And when I start to hypnotize him, his tremor goes away before he went to sleep. And the little 4-year-old in me is jumping up and down like, oh my God, the tremor went away before he went to sleep. So next morning on grand rounds, I told my attending, his name was Dr. Jabari, and he rolled his eyes at me like, I can't believe I have to deal with these idiot psychiatric interns. And, you know, like I said, my dad's favorite word was bullshit. And I'm like, no, watch. And so in front of 8 of my other colleagues, residents and interns, I hypnotized him, and he's fully awake and in a trance. His tremor went away. And Dr. Jabari started paying attention. And then we did a QEEG, or not a QEEG, a regular EEG, resting, and then when he was in a trance, and we videotaped it, and it became my first paper. It's so powerful if you can get a person into a trance and then direct their mind in healing ways.
It's wild.
Absolutely. And the same thing, you reminded me of a stuttering patient, and you couldn't make much sense of what he was trying to speak about, but in a trance, he was speaking fluently. Like sometimes stuttering patients will sing, be able to sing fluidly. So we all have hidden potentials, and the purpose of the trance is to awaken people to the potentials that have previously been dormant.
Right, and it's not stage hypnosis, which is very different. That stage hypnosis often is about entertaining and control. This medical hypnosis, psychological hypnosis, is really about teaching patients about their own personal power.
Right, it's empowerment.
And control.
Right.
That you can control things like pain, to decrease the amount of medication you have, or sleep. When I was on the cardiology ward as an intern, it was an ICU cardiology ward. I was freaked out the whole time because people were dying, and I never wanted to be responsible for anybody dying. And so I couldn't sleep. And then one night I'm like, I can't sleep. I'm so anxious. And I'm like, well, what do you do with your patients when they want a sleeping pill? Because obviously I was on call. I couldn't take a sleeping pill. I'm like, oh, you put them in a trance. And I became so good, I could put myself to sleep in under 2 minutes just by directing my attention to not to the worries, but to the things that help me sleep.
Yeah, that's one of the things that helped me when I was going through all my medical treatments, was doing self-hypnosis with guided imagery to go to
So
sleep.
when we come back, we're going to talk about more of the clinical uses of hypnosis, how you can use this in your life to be healthier, happier, more empowered. And whatever you've learned from this podcast, write it down, post it, and then send us a copy.
Yeah,
We
even
would
if
love
you
to
even if
hear
you
from
have
you.
if you have still have concerns about it, or controversial thoughts, send them to us. We'd love to address them. So this
Stay
is what
with
we're
us.
about.
We'll be right back. Welcome back. So one question to pose to our audience is, what uses could you use hypnosis for? What might be helpful in your life or in the life of those you love? So Jeff, as we talk about this, we're here with Dr. Jeffrey Zeig, the head of the Erickson Foundation, who also does this amazing conference every couple of years, The Evolution of Psychotherapy. Does a story come to mind about how hypnosis has helped one of your patients?
Oh, many stories. There's spectacular cases. Like I can remember one woman who came to me, and she was having episodes that were dissociative. So she would wake up in places in a compromised state, and there was blood, and there was knives, and there were very strange things like a little baby doll. And it was a rare case of somebody who had multiple personality. So and it hadn't been diagnosed at the time. So one of the first interventions was to put her in a trance and have a part of her to communicate using automatic writing. Now, at the beginning of 2020, you'll still be writing 2019. And if you're on a telephone call and you start doodling, it's automatic writing. So what we're doing in hypnosis is taking a facet that can happen normally in life and amplifying that to serve a therapeutic purpose. So I had her write out some of the messages from this part of her that was so aggressive, put them away, fold them up, put them in her purse, and read them at a time when she would find that she could absorb what the message was. In the meantime, as she's writing furiously, and I mean furiously, she's having a conversation with me and the co-therapist in the room and doesn't realize is completely dissociated from what she was writing. And then never did find that piece of paper. But over a couple of months of therapy, and part of it was to be hypnotic and to have her go into a trance and to go away, basically. Like we would say that there were a couple of facets with Sandy I and Sandy Y, and they were different facets of her personality until I could use hypnosis to understand the severe trauma that she had suffered and the fact that that trauma was repressed, and it had been an undercurrent that was guiding her life. Now, in 50 years of practice, I think maybe I've seen two people who fit the diagnosis of having multiple personality in the way that I believed. But the use of hypnosis and amnesia was important in helping her to integrate these fractionated parts of her personality and bring them together so that she could live in peace with herself and wasn't in disharmony with herself due to the fact that she had been so severely traumatized in one point in her life. So that was a use of deep trance. Now, when people come to me and they want to stop smoking or stop using internet pornography or gambling, I don't necessarily need to use a deep trance. You need to use the amount of trance that is necessary to help the person get the realization that they need. Of course, I can stop smoking. Of course, I can do a better job at monitoring my use of the internet, for example. So I don't have to do something that is so spectacular as a dissociative state, automatic writing, deep trance, but help people to realize what they already know.
So
Hypnosis can be like an amplifier in that regard.
And people have different abilities as far as going deep into a trance. Probably not everybody's hypnotizable. You have to have a little bit of an attention span. But I think my experience, I'd be interested in yours, it's about 85% of people can be hypnotized. But only, maybe 15 or 20% of those can go so deep that they actually don't remember what happened. My experience is most people remember what happens in a trance, but time gets distorted. It's almost uniformly a really positive emotional state. Unless control is a huge issue for them, and then they may not be able
I wouldn't
to
say
let it
control is
go.
not a huge issue for me, but I find it
I
an
would say
empowering.
actually it is a huge issue for you.
But I find it empowering, so that's why it doesn't bother me. Do you know what I'm saying? Like, I think it doesn't bother me because I find it an empowering tool. In fact, I used you to hypnotize me for my first black belt test many years ago, and it was so helpful for that. So for things like that, it was just, I was nervous about it. I was scared to do this test and didn't think I was going to make it through. And with the use of that hypnosis, completely changed how I felt going into that test and performed through the test. And I used it again for my second black belt test, which was much harder and I was terrified of. Used it again for that, and I literally felt amazing going through that test. So I really like it for uses that I feel are empowering, and I've used it for it for pain
for
and
performance enhancement.
Absolutely, but I've used it for pain and medical
athletes.
Yeah,
and the difference between being exceptional and being excellent is very small.
Yes,
and so premier athletes would come to me and could they get into the mental state that they need? What is the IPS? What is the ideal performing state for taking your black belt test? Can we use hypnosis as an ancillary to helping people get into adaptive states, and not just use it for something that's problematic, but using for something where you're enhancing performance?
Exactly.
Well, and so
I should say that relaxation, maybe in the last year, I don't even think I've used the word relaxation with a client. Hypnosis is traditionally thought of as like a psychological massage. Like the hypnotist is doing da 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 da, and the client is just into a very passive state. But actually, the problem of hypnosis is activation. How to get people to activate and access the realizations that they need to be more adaptive in their life. The other thing I'd like to mention is that in California, especially, people can be licensed to do hypnosis, and that doesn't require any training at all. Being a hypnotist is not regulated in California. Anybody could put out a shingle and say, I'm a hypnotist. They could take a weekend workshop and say, I'm a hypnotist. And at the Erickson Foundation, we only train people who are enrolled in an accredited graduate program or have a minimum of a master's degree in the health or health sciences. Hypnosis is an adjunct that can be used. But if the person has depression or a bad habit, you could use cognitive therapy, you could use hypnosis, you could use family therapy, you could use Gestalt therapy, psychoanalytic therapy. Every therapist has a tool at his or her disposal, and I don't recommend that clients shop for tools, that they shop for a therapist. I wouldn't take my car to an unlicensed mechanic, so I certainly wouldn't take my psyche to somebody who has a shingle like a hypnotist.
That's a good point. It's a very good point.
When I was young, I learned this technique called hypnoanalysis. Do you remember when that came out?
Sure.
So powerful. And I remember a 16-year-old boy who came to me with a panic disorder. And I hypnotize him. His mother's in the room. And I take him back. And the technique is basically put someone in a trance, take them back to the last time they had that symptom, and ask them what they're thinking and feeling. And so it's, I can't breathe. And then in a trance, have them imagine themselves getting younger and smaller, smaller and younger, and go back to the first time that you couldn't breathe. And so he went back to when he was 4 years old and he had a piece of steak stuck in his throat and turned blue, and there was hysteria all around him until someone did the Heimlich maneuver on him. And he remembered hearing, "Oh my God, you're dying." And that had got cemented a little bit in his subconscious mind. But then I learned you can't go, you need to go back even further. So go back after they go to their, I think it was initial sensitizing event. Is there anything else when you can't breathe? And his mother's in the room. And he goes, "It's dark. I'm wet. And something's around my neck and I can't breathe." And his mother all of a sudden starts crying because he was born with the cord wrapped around his neck. Now, I don't know what people think about that, but as you then begin to plant "you're safe, people love you," healing images, he never had a panic attack after that. And I found that bridging technique to be so helpful over the years. What's happening at the time you're having this symptom? When's the first time you had it? And go back even further if you can. Do you remember learning about that?
Sure, yeah. An affect bridge can be created around an emotion or an image or a sound, and you're just allowing the person to go back in time to this traumatizing event. And if you can go back before and you are providing somebody with some initiative that helps them to realize that they don't have to continue the debility that they've had, whatever it takes and however it is that you coordinate with the belief system of the client. And sometimes the belief system of the client conforms to the belief system of the therapist. But if people get better, whatever it takes to help people to get better, I'm for it.
So, but that also brings up, and maybe we can talk about it in the next podcast, is Brian Weiss's work, Many Lives, Many Masters, because he was a psychiatrist who accidentally, according to him, took someone back and they flipped into a past life. Stay with us. Welcome back. We are here with Dr. Jeffrey Zeig. We're so grateful for his time, the founder and director of the Milton Erickson Foundation, also hugely influential in helping to support Man's Search for Meaning and Viktor Frankl's work in the United States. He runs the Evolution of Psychotherapy Conference, one of the largest, most influential psychotherapy conferences in history. And we're just so grateful to talk about this really fun, helpful topic of hypnosis. So I think we've talked about it's not of the devil. It's a medical treatment that has been used actually since the time of Mesmer. And Mesmer was around 1760, 1770, wildly popular. But the scientific community was not a fan. Actually, Benjamin Franklin was part of the group that investigated Mesmer and the whole mesmerism. And they said, oh, it's nothing more than suggestion, such as suggestion is really a bad idea.
Right. It is suggestion in a powerful way.
It can be really helpful. idea, but then used by Charcot and used by Freud, at least initially. It's really been part of psychiatry since psychiatry's inception, and way less toxic than most of the medications we use or some of the really insane things we've done to try to help people heal. So, we've been talking about some of its uses, like sleep and pain,
performance,
irritable bowel syndrome. Do you think, Jeff, this is something we should actually be teaching most children, how to use self-hypnosis?
Sure, how to use your mind, how to use your brain. You've been a champion of that, Dan, and helping people to understand brain health, brain welfare, and brain possibilities. And so the earlier that we can teach people how to use the potentials that they're born with, the better we'll be as a society.
Yeah, we don't call it hypnosis per se, but we've been working with Chloe since she was a baby pretty much on focus. So on focusing what is good and focusing on what you want to achieve, what you want to be, and not focusing on what you don't want, and then meditating on that, praying on that, really focusing.
Well, we have a great Chloe story. And
oh yeah, she actually.
And I'm also a child psychiatrist, so I've used it with children a lot. And from what I remember, hypnotizability peaks around the age of 11. And because children don't have the adult belief they can't do something, they are much more able to go into trances and utilize the information. So do you want to talk about the story?
So it was 4th of July, and she decided to make something on her own. She wanted to make something, and so she heated up some almond butter, and I didn't know she put it in the microwave, and it got overly hot. She went to get it out, and it's bubbled over onto her hand, and she burned her finger pretty good. Now, it wasn't like a 3rd-degree burn, but I mean, it blistered her finger. So I'm a nurse, and I'm trying to wrap it and clean it and do all this stuff, and I'm talking really sweet to her, and she is screaming. She's screaming. She won't settle down. She's hyperventilating, and I think she's working herself up even more than what the wound warranted. But kids do that, right? So she was about what?
We all do
she was
that.
7 or 8. She's about 7 or 8. And so she is just getting more and more worked up.
And she hates herself. I'm so stupid.
She kept saying, I'm so stupid. I'm so stupid. I'm so stupid. I hate myself. Why did I do that? I mean, I'm like, what? You just burned yours. I'm like, honey, this is just a mistake. But she's not having any of it. She's just going on and on and on. I'm trying to read her a story. 2 hours later, she's still worked up and going on, won't go to sleep. And I finally am just at my wit's end. And I go in and I'm like, I need help with this kid. I can't get her to sleep.
So I have no idea what's going on. I'm in my office working.
And she's just like out of control. So I go get Daniel. I'm like, I have no idea what to do with her. She just will not settle down. She is just out of control, and it's just getting worse, not better. And it's like 10 o'clock at night. So he goes in there, and now you take it from there.
So, and I see how upset she is, and I'm like, oh, we should put her in a trance. So I talk softly to her. I tell her it's all going to be okay, and I have her focus on a spot on the wall above her eye level. And I said, sweetie, I'm going to count to 20. And as I count to 20, I just want your eyes to begin to feel really heavy. And by 20, her eyes are closed. She's calmer. She's breathing better. Do a little bit of progressive relaxation, and she's gone. It was awesome. Take her to a park, to a pool, have her put her hand in the healing water of the pool.
She got all of her favorite animals with her. And
yeah, no, I mean, the more visualization you can do, the better, my experience. And I suggested that we'd turn off the pain and that she would go to sleep, and in the morning, everything would be fine.
Oh, and that people make mistakes, and there's no reason. I mean, he did this whole thing about there's no reason to feel bad, and, so.
And then we left, and,
out.
we're wondering, 5 minutes
Middle
later,
of the night,
will
is she
she
gonna
be
come in screaming?
And we didn't see her until the morning, and I'm like, hey, how are you? She's like, I'm really fine. And people make mistakes. It's okay.
Never mentioned her finger again.
Super. Yep.
So
that's a transformative experience, and that's one of the building blocks of adult functioning. So once you can help a child to get that kind of a realization, that is pure gold for enjoying and being effective in life.
Yeah, and one of the things that you taught me, I mean, hypnosis is, I mean, as we've discussed, is one of my favorite tools. But even like with a child, before you get to that level of even medical hypnosis, because hypnosis is really helping you focus, right? It's a focus on your potential. So one thing we do that you've helped me with is asking her questions that help her to focus. So getting her to focus on the right things with the use of questions over and over and over. So redirecting her attention and her energy. If you can, I think, do that with kids and really get them focusing on the right things, because especially in adolescence, they're not focused often on the right things, but getting them to focus on the right things through the use of questions is really powerful.
Well, and I think I'd be interested in your thoughts, Jeff, that social media actually uses hypnosis in a very negative
way for kids.
That people are entranced by their phones, that they actually lose time. So, I have 3 minutes to check Instagram, and 40 minutes later, they're still there. And the unconscious message that you're not enough, you're not pretty enough, you're not smart enough, you're not rich enough, just is pervasive. And then kids feel terrible about themselves. The incidence of teenage depression has skyrocketed, right? When you and I were in training, we didn't see the numbers of kids who are suffering the way they are now, even though as a society we have more. Emotionally, they feel like they have less.
Mm-hmm.
Yeah, well, there could be empowering messages just as well as the subterranean disempowering messages that are more pervasive in the internet world. But I have to think that I'm an inadequate hypnotist, because the people who are capable of creating games and Facebook and Instagram and all of these things that exist have figured out ways to suck people in and to influence people and to get people involved in a focused state that may not be as valuable for them. And it's amazing that people's brains can be malleable enough to keep up with some of the incredible things that can happen in the media and also on their iPad or their personal cell phone. The amount of things that people are being exposed to. I know that there was a study many years ago, before the internet, that the average child between 3 and 18 saw 100,000 murders and 300,000 acts of violence. Now, I'm sure that that figure is very conservative compared to what happens today. So bombarding children with violence and with pain is not the best way to build self-esteem. And it would be nice to know that these designers would have ways of helping people, like games that could be where children group together to defeat the game, and would be more a positive experience than I'm better than you are at using Fortnite.
Right. It's amazing that we might not even have time to talk about it, but we haven't talked about the hypnotic state that kids go into with these violent video games. So I don't want to get into the discussion of guns, no guns, but all of these shootings that we see, everyone's focused on the guns, but no one's thinking about these kids go into, because there's a really interesting fact that a lot of people don't even know about, and that is that the US government adopted the technology from Nintendo, okay, because they started to realize that kids could walk into a room and commit these violent acts. Do you know how hard it is to hit a moving target? But these kids were able to walk into a room they've never seen or they've never been to, and hit moving people. And the government began to realize, wait a second, these kids are actually better at it than our soldiers. They adopted that technology and began to utilize it.
All right.
So it makes you wonder.
Before we stop, let's bring this back to helpful.
But that's hypnotic.
Yes, I agree. And I brought it up with social media, but we only have a few minutes left. And Jeff, you said some really important things. Don't just go to someone for hypnosis that's a hypnotist who's also not a trained psychiatrist, psychologist, marriage and family therapist, social worker, because often people will go, but there's an underlying major depression, or there's an underlying bipolar disorder or post-traumatic stress disorder. This is a tool to be used by a competent therapist that can be so helpful. On Brain Fit Life, that's our online tool. It's our app that is like brain health in your pocket or purse. I actually do 6 hypnosis audios for people, sleep, pain, anxiety, peak performance, weight, smoking. Those things can be helpful, but it's always best done in the context of someone who is a professional. I wrote a book once that I think you'd really like. It's called Time for Bed, Sleepyhead. It's a hypnotic game. It's really a hypnotic book to put children to sleep. When my daughter Brienne was 3, she wouldn't go to bed one night, and she and I were just like bonded. And I must have had a bad day because I was really upset, and I got angry at her. And I felt so guilty for being angry at her that I'm like, come on, you can do better. Put her in a trance. And then I basically told her that story for the next 5 years because she loved the sleepy time story. So, so there's lots of resources. Which of your books should people read, or which of your resources could be helpful to our audience?
Most of my work, most of my writing is for professionals. So the books that I have that would be interesting for the trade, interesting for the lay audience, they're not about hypnosis. I have one book which is 10 Commandments for couples, and another book which is The Habit of a Happy Life. And those are available from zeigtucker.com, which is a publishing company that I also run. For the people who are professionals who want to learn about Erickson, about advances in evocative approaches to psychotherapy, hypnotic approaches to psychotherapy, they can go to the Erickson Foundation website. And the Erickson Foundation also has a press, and many of my professional books are on the Erickson Foundation site. But what I'm, trying to do, which is what you said at the beginning, is to understand influence, and that hypnosis is the foundation in psychiatry, psychotherapy, of using an evocative technique. You don't put person into hypnosis to give them information. You put somebody into hypnosis to demonstrate you can change your state. You're not the slave of your depression, your anxiety, your habit, your bad relationship. You can change your state. And if you can change your state once and demonstrate to yourself you can change your state once, get in as if you're thinking about a standard shift car. You're in reverse right now. You're coming to me for help. I do a trance. You go into neutral. You demonstrate, I can change my state. Once you can get into neutral, then you can begin to move into first gear. But again, I don't recommend that people shop for techniques, that they shop for the right person. Each person will have different techniques. Each expert, each therapist, licensed physician, psychiatrist will have a technology at his disposal. And once you find the right person, the technique will help to get you there. But looking for the technique first is putting the cart before the horse. Dan, you've been a wonderful friend and a great friend of the Erickson Foundation and a great supporter of our work and the conferences that we do. And you've been a remarkable contributor, both of you, to helping people to live more healthful lives. And if we call that hypnosis, that's, probably going to diminish some of the effect that you've had. You've had a marvelous effect at helping people to realize, both of you, keep your brain healthy. This is what you need to live, what you need to function adequately in life. So bless you for all of the things that both of you are doing to bring health to life.
Thanks, Jeff.
That is wonderful. I'm so grateful. If it wasn't for the imaging work that I stumbled across, that hypnosis would have been probably my life's work, because I just loved it so much. But then when I started looking at the brain, I'm like, oh, hardware and software. You got to get the hardware right first, and then it's so much easier to program. So what after listening to the hypnosis series with Dr. Zeig, what's the one thing you learned?
Yeah.
What's the one thing that you can apply in your life? Post it to any of your social media sites
and tag
be sure
us.
to tag us, hashtag Brain Warriors Way. And then please write a review, write questions. We'd love to hear from you.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're interested in coming to Amen Clinics, use the code PODCAST10 to get a 10% discount on a full evaluation at amenclinics.com. For more information, give us a call at 855-978-1363.